Hello, I am Admiral Rachel Levine, Assistant Secretary for Health at the United States Department of Health and Human Services. Eating disorders do not discriminate. They affect people of all ages, racial and ethnic backgrounds, gender identities, sexual orientations, body shapes, ability levels, socioeconomic statuses, and geographic locations. An estimated 28 million Americans will experience an eating disorder in their lifetime. Each year, we recognize National Eating Disorder Awareness Week, not only to acknowledge the serious impact that eating disorders have on individuals' health and well-being, but also to highlight the available resources for those who may be looking for support. This year, HHS encourages everyone to continue the conversation with our theme, Let's Talk About It, Eating Disorders, Stigma, and Empowered Recovery. One of our goals is to dispel common eating disorder myths and address stigma. We also want to raise awareness about disparities in diagnosis and treatment for minority and underserved populations, and highlight best practices for improving quality of care. Finally, we aim to encourage self-advocacy when seeking support and recovery. Agencies across the Department of Health and Human Services remain dedicated to providing resources, education, and support for those who may be affected by eating disorders. The Substance Abuse and Mental Health Services Administration, or SAMHSA, continues to fund the National Center of Excellence for Eating Disorders, supporting healthcare providers, families, caregivers, and community members, and helping them access new tools and trainings to help detect and treat eating disorders. The Office on Women's Health has expanded access to education and resources on eating disorders by administering the grant Addressing Eating Disorders in Adolescent Girls and the COVID-19 Pandemic. Through this collaboration, we are working with George Mason University and Washington University to help communities affected by eating disorders access effective screening, treatment, and care. This work has led to wide-scale implementation of evidence-based training for professionals and noted increases in routine assessments for eating disorder symptoms within target communities. These are just a few examples of the great work happening at the federal level to combat eating disorders. The more we learn about eating disorders, the more we can work together to overcome stigma and help those in our lives who may be struggling find support that they need. So this year, for Eating Disorder Awareness Week, let's talk about it.
Produced by the U.S. Department of Health and Human Services.